Hello, my name is Ray Jones. I'm Professor of Health Informatics at Plymouth University, and clearly I'm not anonymous. Anonymous, it means without a name, but actually online things aren't quite so simple, and sometimes we have pseudonymity rather than anonymity. In pseudonymity we have a unique identifier which links records, data and messages, but without necessarily disclosing our own personal identity, our birth certificate identity, being able to recognise us on the street. For example, we have a Twitter name which may or may not be your real name. You can have some pseudonymity, but all your Twitter messages are linked together with that same name, and it may be the same name that you use in Facebook. Sometimes, of course, people refer to this as anonymity. They use anonymity to refer to both real anonymity and pseudonymity. In fact, we're not really sure that anonymity really exists. I mean, the only thing you've got is use your fingerprint. There's so many ways now that you can identify who somebody is. But particularly online, you may be anonymous to one group of people, but may be known to others. For example, anonymity is very important for some people. Some discussion forums, I've done some work with young people who self-harm, and for them it's really important to maintain that anonymity so that people don't really know their real life identity. So actually it's pseudonymity, because often they're discussing things under a particular name of that they may use for that particular forum. In real life, of course, knowing the name of your clinician is thought important by patients, and many of you will have found dealing with anonymous service desks or organisations very annoying, where people won't give you their name and they hide behind things like, oh, they say, it's a Data Protection Act, sorry I can't give you my name, which is of course not true. As a clinician, it's thought to be professional to give you a name, and many of you will have come across the excellent campaign started by Kate Granger called Hello, My Name Is. And this is one thing that we're trying to get all nurses, all other clinicians to say, hello, my name is whatever, when you first meet a patient. And maybe we should be doing that online as well. However, if the person may be vulnerable in some way, it may be that it can be acceptable for a professional to be anonymous to some. So, for example, in our PUNC, Plymouth University Nursing Cohort project, we don't insist that our students give their real name. They can use a pseudonym if they want to, but we, the university, know who they are. What do you think?